This one.
Okay.
Is it a video?
No, I got it.
Yeah, it's a video.
Gang!
Oh my god.
Okay.
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 Once you're set, I'll go ahead and start. I'm sure if I were to tell you that there's a drug that can safely and effectively disassociate your mind from your body, ketamine probably isn't the first thing on your list. So that's the kind of premise of my speech. This year's ketamine, another name for it is Ketalar, and that'd be the molecular makeup of it. So I'll go through the rest of the stuff on there. The bigger words I'll kind of break down into more like common terms. And the biggest thing we're going to cover is how ketamine works in the body. Its uses in the medical field. I am a current EMT and then a paramedic student, so I'm going to focus more on kind of the pre-hospital, more acute care type stuff, less the hospital. We'll talk about some studies that kind of prove and some evidentiary stuff, and then also a common myth in the medical field, and then some benefits to ketamine over other induction agents. So ketamine is actually a derivative of the drug phencyclidine, which is more commonly known as PCP, which is also a horse tranquilizer, which, yes, we are giving that to people. It's actually a safe and very effective drug. So the primary uses for it are an induction agent. By that, it's one of many induction agents. Induction is for rapid sequence induction, which is where someone kind of has an airway, still is kind of awake. You knock them out. Ketamine does that successfully. It does these three things. So it is an analgesic, which is a fancy way to say pain relief. An anesthetic, which is sedation of the mind, basically effectively knocks out the mind. I'll talk about how it does that. And then it has some amnestic, some amnesia-type properties, which is if you get given, you're kind of in like a haze and you don't really remember said treatment that went on. So kind of the hot topic now is whether or not ketamine's safe in the treatment of pain. So EMS, their really protocols only allow us to use it for an induction agent and then also for excited delirium, which is if people are on stimulants like meth, cocaine, and they're freaking out and stuff like that, we give them that, calm them down, because that is actually, it can get to the point where it's a life-threatening emergency. So it's dose-dependent. It affects so a higher dose is what we use for RSI, rapid sequence induction agent, when it's being used as an induction agent. It's about 2 milligrams per kilogram, and to kind of put that in perspective against the low dose of ketamine is which is 0.1 to 0.3, is like if you have a 100-kilogram person, you're going to give them 200 milligrams of ketamine for induction versus like 10 milligrams for pain. So the biggest kind of side effect of ketamine that you kind of have to watch out for is it does have like when they wake up from it, they can kind of hallucinate, and it can give people kind of a wiggy, like if you don't knock them all the way out, they can kind of get disassociative and kind of uncomfortable. So there's a recent study done by University of California and Alameda Health Systems Departments of Emergency Medicine, published in 2014, and it basically proved that ketamine is the equivalent to morphine and can be in pain reduction. So how it kind of works, we give ketamine, and it is it'll start working within about 45 to 60 seconds. It's going to last you like 10 to 20 minutes. Once that happens, it's metabolized by the liver, excreted in the urine. So that's how it ends up exiting the body. So the way it actually disassociates the mind from the body is through receptors. They're called NMDA receptors. So you come over here. So this is like a neuron. These are two neurons. Let's say the brain's up here carrying impulses down to the spinal cord. This is what's called a synapse. So the neurotransmitter, this is just whatever chemical is going to carry the signal. The NMDA receptors are here to receive that. So they're basically kind of the bridge between the brain and the spinal cord. And ketamine is an NMDA antagonist, which means it basically, in essence, takes these out of commission. So like that's how you get so now you have a mind separated from the body. So they don't feel pain, they don't really know what's going on, and then you're able to give a paralytic, and now you can intubate. So that's that's kind of the biggest thing that's like the pharmacological stuff of ketamine. And then we'll come back to some other things that it releases as well. So it's, like I said, the biggest side effect is going to be the hallucinogens, and then primary is induction agent. And like, so paramedics follow protocols, and protocols are going to be like a medical director or physician says, hey, you can do this when this happens, this when this happens. The ketamine's used for kind of acute pain isn't really established yet. So pre-hospital, we really just have it for the excited delirium, for so stimulant use and then to facilitate inhibition are the two biggest things that we use it for. So like I said, the high doses and the low doses. The low doses you need to worry about that kind of dissociative effect happening because you might get rid of their pain, but you might now have a patient who's kind of like getting wiggy and a little freaked out because they don't really know what's going on. So ketamine in the another thing ketamine releases is catecholamines, and that's just a fancy way of saying this is like a class of neurotransmitters, which are these little dots that I so masterfully articulated on the board here. So it's just a fancy of neurotransmitters, and they elicit a sympathetic reaction, and what that means is fight or flight response. So you're about to get in a fight, you're either going to fight or you're flight. That's kind of that adrenaline stuff you get. So that's really a fancy way. Is this raises your pulse and your blood pressure. So a big kind of myth about ketamine was in a head injury patient, you don't want to give ketamine to induce an intubation because it raises heart rate, raises blood pressure. So to kind of explain this, I'll have to explain the anatomy of a head injury a little bit. So if you hit your head, now you have a head bleed. Let's say your brain's swelling, you got swelling in the brain. It's gonna raise your intracranial pressure, and it's normally your intracranial pressure is normally right around like 10, right? So if any increase, it'll start literally like pushing your brain like to the side, so it's gonna start pushing blood and like the blood supply out of there. So that's like the head injury is gonna progress as the blood pools. It's gonna depend on the rate of the bleed and stuff like that. So intracranial pressure is actually, you're going to see the patient's blood pressure start getting boosted up. So it makes it bleed faster, but it's actually compensating for it. It's actually compensating for lack of perfusion. It's raising what's called mean arterial pressure. So the pressure that's in the arteries, and it's raising that, it actually keeps the brain perfused like it's supposed to be. So it's actually a compensatory mechanism. So when you give ketamine, it does increase your intracranial pressure a little bit, but it actually offsets with it because of the mean arterial pressure and everything. It actually isn't like as big of an issue as people once thought. So that, and then also because of that catecholamine release, if you have a patient who's like hypotensive, which means low blood pressure, they're hurt, head injury, it actually makes it an excellent choice because you don't want them to have low blood pressure, they're bleeding out somewhere, so that boost in blood pressure, boost in heart rate can actually help them out. So that's kind of the overview of ketamine and its pre-hospital use. If you guys are interested, I encourage you. I'm sure there's videos and things online. You guys can kind of look at more stuff. If you want more in depth, you can go ahead and take a look at look at even bigger words. I'm sure you guys would enjoy that. But I appreciate your time, and I hope you all have a good rest of your day. If you just want to show, you can clap. It's over now.